Hi, today I'll be presenting on global implementation of PrEP. First, starting with some background, although HIV incidence has declined by 16% since 2010, a promising trend towards the end of HIV transmission, there's still a lot of work to be done. For example, UNAIDS estimates that in 2018, 1.7 million people globally became newly HIV positive. Global HIV prevention efforts continue to emphasize treatment, testing, and condoms as integral components of HIV prevention. However, in addition to these efforts, the biomedical prevention model has arisen as a key strategy for preventing HIV in recent years. This includes use of antiretroviral drugs as pre-exposure prophylaxis, otherwise known as PrEP. PrEP is a medicine that prevents the acquisition of HIV and can be taken either daily or on an event-based dosing schedule, commonly referred to as 2-on-1 dosing. Zooming out to a global view of PrEP implementation, this map offers a visual of PrEP adoption by country as of April 2020. As you can see, adoption of PrEP varies by country and region, and PrEP use is largely concentrated in the United States and Canada, Australia, European nations, as well as some sub-Saharan African nations, Brazil, and several Southeast Asian countries. The map uses data from AVAC's PrEP Watch, which aggregates several sources of data to provide the most comprehensive picture of global PrEP implementation that we currently have today. Included in these efforts is a spreadsheet that is freely available to the public, which lists PrEP uptake by country, as well as the current programming available in each country for which AVAC has data. One of the key characteristics of global efforts tracked in AVAC's Global Tracker is the stage of implementation in each country. For example, some countries have yet to adopt PrEP, while others have PrEP only available through clinical trials, demonstration projects, and implementation projects. States further along in scaling up PrEP have adopted national programming of PrEP, many of whom, although not all, have their own state guidelines for PrEP. Although universal PrEP access is the goal, we're still pretty far from that goal. As of 2020, our best estimate is that around 580,000 people are on PrEP globally. As a point of comparison, UNAIDS global targets aim to have 3 million people from key regions and populations on PrEP as of 2020. So we're at less than 20% of that goal today. These are some of the key bilateral and multilateral organizations and funders directly involved in scaling up PrEP access globally. I've already mentioned the role that AVAC plays in tracking and surveilling PrEP implementation and uptake globally. However, they also play a key advocacy role, calling on PEPFAR to scale up implementation operations, and they've also made demands of the World Health Organization in the interest of PrEP, specifically criticizing WHO for blind spots around stigma that acts as a barrier to PrEP uptake. That said, the first global guidelines for PrEP came from the World Health Organization, and they have been really important for advancing the acceptability of PrEP as a global strategy for preventing HIV. This is critical as there was initially concern and hesitancy around this strategy within global health organizations and public health ministries, with experts concerned about disrupting the condom-centric HIV prevention model and others worried about efficacy. Concerns about efficacy were largely a result of early clinical trials, which underperformed expectations for various reasons. Additionally, PEPFAR has played a critical role in providing treatment and HIV prevention programming in countries most impacted by HIV. However, PEPFAR has been somewhat late to adopting PrEP into their programming, with PrEP programs only beginning to roll out as of 2016, 4 years after its approval. An MMWR report highlights that in 2018, only 13 of 35 PEPFAR-supported countries had scaled up PrEP for key populations at the time. Global PrEP adoption continues to lag need. However, the past 4 years have seen an increase in global PrEP data collection, implementation, and program monitoring, marking a promising shift towards greater global PrEP adoption. As previously mentioned, the World Health Organization released the first global guidelines for PrEP in 2012. These guidelines provided clinical guidance for prescribing PrEP, including clinical follow-up appointments, which includes HIV testing, STI testing, and renal testing for toxicity. Following initial WHO guidelines, PEPFAR released guidelines for the logistics and priorities needed for global PrEP implementation. 2 years later came the World Health Organization's Comprehensive Implementation Toolkit, which guides PrEP implementation efforts globally by providing guidelines for community health workers, counselors, community leaders, as well as provides a framework for monitoring and evaluating PrEP programming and surveillance of current PrEP users. As you can see on the slide, the PrEP implementation toolkit covers a vast array of implementation issues that may come up and really guides global efforts to scale up PrEP. Among early adopting nations, several successful models for delivering PrEP have emerged. For example, in Thailand, the peer model of delivery has been used as part of the Princess PrEP program, which trained trans women and men who have sex with men to connect their peers to HIV prevention services, including PrEP. This model has been more successful than other public health programs at engaging trans women and MSM in HIV prevention programming. Alternately, the nurse-led model has been tested in San Francisco and Australia. It allows nurses to provide PrEP care, expanding medical personnel available for the delivery and maintenance of PrEP. Some experts have proposed that demedicalizing PrEP and providing PrEP outside of clinical settings will improve access and uptake, while others propose that the integration of PrEP with other services like family planning and economic and social programming can also expand access. The latter has been tested in parts of Africa as part of the DREAMS program, which integrated PrEP into a larger social program for young and adolescent women. Although some models have been successful, there are a myriad of challenges facing global PrEP implementation. These are some of the most salient challenges I came across while preparing for this presentation. First, limited state guidelines sometimes leave physicians uncertain about the procedures for providing PrEP. In response to this issue, WHO has released an app aimed to provide comprehensive and accessible guidance to providers prescribing PrEP. This could fill a critical information gap for physicians who lack state-level guidelines. Second, WHO and PEPFAR data collection measures have been critiqued as missing key statistics on discontinuation, community-level use, and information around seasons of PrEP use. By seasons of PrEP use, I am referring to when users go on and off PrEP based on a self-risk assessment. These data would give a more complete picture of PrEP coverage among communities and key populations at risk for HIV, and could better inform implementation efforts. Next, PrEP access remains a challenge. In some countries, PrEP is only available through studies, and thus access is severely limited. Further, in other countries, PrEP has been limited by its high cost, which can overburden public health systems and global health programs, and lead to cost shifting onto individuals. Universal primary care access and affordable generic PrEP are critical to overcome access issues to PrEP globally. Stigma and homophobia have also acted as significant barriers to PrEP, as states without laws protecting key populations may have a more difficult time getting PrEP into the hands of those most vulnerable to HIV. Thus, policies that protect key populations like MSM and trans women are really important and should be prioritized by global health organizations working to end HIV. Last, low awareness and knowledge of PrEP continue to act as barriers to uptake. In response to this issue, PrEP Watch created the PrEP Communications Accelerator, which is a communications tool that helps countries build campaigns and messaging to create demand for PrEP. In summary, efforts to make PrEP globally accessible are ongoing, and uptake continues to lag global need. Global health organizations are working in partnership with state governments and programmers to make PrEP accessible. However, global PrEP efforts were initially delayed, in part due to early controversies and concerns around PrEP. These concerns have been largely abandoned with the success of PrEP at preventing HIV, both in more recent studies and real-life implementation. Global policies provide much-needed guidance for PrEP implementation, and accessible tools like apps can help provide key information to physicians and health workers implementing PrEP. All told, implementation efforts still face numerous challenges and will rely on continued funding from global organizations and innovative solutions for overcoming challenges to global adoption. PrEP uptake will likely be a key component to ending HIV transmission and meeting global HIV targets by 2030. Thank you very much.